Have you ever wondered how powerful treatments zero in on their targets, especially when dealing with something as complex as a brain condition? It is a common question to ask how medicines work inside our bodies, distinguishing between healthy and diseased cells. When it comes to traditional chemotherapy drugs, the answer is quite fascinating but also nuanced. These drugs do not actually know which cells to kill in the way a smart guided missile might. Instead, they operate on a fundamental biological principle, primarily targeting cells that are rapidly dividing and growing, which is a key characteristic of cancer cells. The core mechanism behind conventional chemotherapy involves disrupting the cell division cycle, also known as the mitotic cycle. Cancer cells are notorious for their uncontrolled and rapid growth, making them highly susceptible to these potent medications. Different chemotherapy agents work in various ways. Some, called alkylating agents, directly damage the DNA of cancer cells, preventing them from replicating. Others, known as antimetabolites, mimic essential building blocks of DNA and RNA, thereby interfering with genetic material synthesis. Still others, like mitotic inhibitors, prevent cells from properly dividing. This broad approach is effective because cancer cells are aggressively trying to multiply. However, this mechanism also means that healthy cells in your body which naturally divide quickly, such as those in your hair follicles, bone marrow, and the delicate lining of your digestive tract, can also be inadvertently affected. This is precisely why patients often experience well-known side effects like hair loss, fatigue due to low blood counts, and nausea or mouth sores, as these healthy, fast-growing cells are caught in the treatment's wide net. Understanding this process is truly empowering and can help you feel more in control. To navigate chemotherapy treatment effectively, it is absolutely essential to communicate openly and regularly with your healthcare team. Do not hesitate to ask specific questions about the drugs you will be receiving, what potential side effects to anticipate, and most importantly, how those side effects can be managed or mitigated. Your medical team can provide detailed insights into your unique treatment plan, including practical strategies to alleviate discomfort and help you maintain the best possible quality of life throughout the process. Preparing a comprehensive list of questions before your appointments can be incredibly helpful for both you and your medical providers. While traditional chemotherapy has a broad, systemic impact, medical science is constantly and rapidly advancing. Researchers are developing newer generations of treatments, often referred to as targeted therapies or immunotherapies, that are designed to home in on specific molecular changes unique to cancer cells or to boost your body's own immune system to fight the cancer. These innovative treatments aim to increase selectivity significantly and reduce collateral damage to healthy tissues. For instance, some targeted drugs block specific growth pathways that only cancer cells relying on, offering a more precise attack. Others stimulate your immune cells to recognize and destroy cancer. This ongoing research represents a significant leap towards more intelligent, precise, and personalized treatment approaches for various cancers. So, to directly address the initial question, traditional chemotherapy drugs do not possess a conscious knowledge of which cells to target. However, their scientific design effectively exploits the rapid division of cancer cells, making them a vital weapon against many forms of cancer. By understanding their mechanism, actively engaging with your medical team, and staying informed about advancements, you can better prepare for treatment and manage its effects. This knowledge helps empower you to become an active, informed participant in your own care journey, making confident decisions every step of the way.